Joining us live now is AMA Vice President Dr. Chris Moy. Dr. Chris Moy, thank you for joining us. We do just have some breaking news. The trans-Tasman bubble will recommence. Australia will be reopening its border to New Zealand. Do you welcome the news?
That's good news. Obviously, there's greater reassurance now that South African strain that got into New Zealand is under control. And from our perspective, that's positive news because that's an enormous threat to us. So I do understand the decision to close things down initially, but obviously if we've got data that says that it looks like that's under control, that's really good news.
Was this the right decision to suspend the border arrangement, or the bubble arrangement rather, and should we do this again if there's another outbreak?
Look, I think that the concerns about the new strains are valid. The problem with them, and I know every time I get asked the question about this is, are we going for elimination? And, they're like, as if we're being a little bit gutless about this. The issue with these new strains is because they increase infectivity, their ability to spread throughout the community is so much faster. It can go from nothing to an outbreak very, very quickly. So it gets out of control. Essentially, that's what's happened in the United Kingdom, where despite having some level of restrictions, it's just got really out of control, even despite sort of near lockdown conditions. So the thing is it's not a matter of actually just trying to, being overly careful and trying to knock it out. It's about not allowing something that could get out of control really easy to take hold. So, I fully support the decision because really it is a bit similar to what happened in Queensland when they had their 3-day lockdown. It gave them time to really assess what's going on and really a few days to knock it out.
Okay. The government says that the vaccine rollout is on track despite a new export threat from the EU. Do you think it's inevitable that at some point there will be delays with this vaccine?
Look, I think that's a possibility and we have to be ready for that. And the reality is that unfortunately, it's a bit like that movie Contagion. If you ever saw, everybody was fighting over vaccines and it was quite unseemly. And unfortunately, we're seeing a little bit of that, this vaccine nationalism, which is, bottom line is it may affect the supply of vaccines across the world because everybody's after it. And I don't think that people would understand that, but it's come to that point. You're seeing everybody. This is a very, very precious thing, these vaccines. Now, for Australia, I suppose what I'd say is, despite the fact that we've heard these worrying things, my understanding is we still look as though we're on track with the Pfizer because the numbers are relatively small for us. So we may not actually make a big difference in the scheme of things. So we may still get our initial supplies. But also, I think the thing to keep in mind is that the Australian strategy, and I do have to hand it to the authorities with regards to this, that the Minister Department of Health had the foresight to understand that part of the strategy priority was to make sure that Australia would be able to manufacture the vaccines quickly, and that's the AstraZeneca and the Novavax vaccines, very quickly if something like this happens, so we get assured supply. So, look, there may be some argy-bargy which affects things up front, but for Australia, hopefully there won't be any, for the bigger bulk push on that is the main vaccination, it won't make a lot of difference.